coming good?
Yeah, it's coming. Good afternoon, good evening, good morning, depending on where you are. This is Dr. Jacqueline King, and I am back. I was just here a few minutes ago. I know that's what you're saying, but I'm back, and I'm with my new guest, Dr. David Ajibade, who is committed to the health of Black and Brown people. And so he's really doing a lot of work with Alzheimer's. And so I'll let you go ahead and introduce yourself, Dr. Ajibade.
Well, hello, Dr. King. Well, you said new guest. I
Well, I
believe
mean, you're not a new guest because you've been on there many times, but when I say new, I just had another guest on hour ago.
Oh, okay. Okay, cool. Fine. Hello, everyone. I'm Dr. David Ajibade. Thank you, Dr. King, for inviting me, as always. It's always a privilege to talk to your group. I run the Brain and Body Foundation. I'm a medical doctor. We're based both in Nigeria and the US. And our main role is really to take the discoveries of the Western world, of developed countries, especially in the fields of brain health. We also do other areas, cardiovascular health and heart health and immune system health and so on and so forth. But see how we can translate them to into practical solutions in third world developing countries like Nigeria, where we don't have access, for instance, to top-rated neurosurgeons or neurologists or neuropsychiatrists. We don't have access to anything. Most people don't have any access to anything brain, any form of brain treatment whatsoever. And yet we have a large number of people who are suffering from brain disorders, from kids to adults. So our goal is really to find simple, practical, and of course, safe solutions to these problems. If we improve their health by 25%, that is a good thing. Now, speaking about dementia, we started getting really interested in dementia and the related brain disorders because we started seeing that it's rising all over the world, especially in the US. And believe it or not, Dr. King, I don't know if you know this, but Baltimore is like the nerve center. It's like ground zero for dementia, especially dementia among Blacks. Well, Blacks are twice as likely to have dementia as whites, and our dementia is more severe. But then it's the most number of Black people with dementia is in Baltimore. The most number of people with dementia, period, is in Baltimore. And Maryland state is the state with the most number of people with dementia. So we are in a very interesting position. And I felt that if there's any solutions that are to be gotten, this is the best place. I'm privileged to be in this part of the world at this time. And so we're actively looking for ways to improve the brain health of Black people, and also to find those solutions so we can export them, so to speak, to other parts of the world, especially Africa, where the rates of dementia are rising rapidly. So,
Um, First of all, everyone, thank you for tuning in. Let us know where you're tuning in from, and share the broadcast, please. So why is that, Baltimore? That's kind of weird.
well, good question. Well, for one, Baltimore is the second largest city. Second, if you look at on the major cities, there are cities that have 500,000 and above. Detroit is number one with the Black population, I think about 70%. Baltimore is number two or number three. So that's one reason. A lot of Black people in Baltimore and the surrounding areas. I know a lot of Nigerians, like Baltimore, Maryland, is like a second Nigerian home for a lot of people. And other than that, I think it's just the numbers question that there are a lot of people with dementia in this area. I mean, a lot of Black people. As to why Black people have higher rates of dementia than whites, I'm just give you a quick story. I was listening to a Black journalist interview a famous Black neurosurgeon, and he was asking him the same question. He's like, "Why are Black people have twice the rate of dementia as white people do?" And the neurosurgeon he paused for a while, and then he thought about it, and then finally he answered. All this time I was like, my ears were perked up. I was like, surely we're going to get some insight. And he said, "We don't know." And the journalist just said, "Oh, really?" And then they just moved on to the next topic, as if, well, it's no big deal. Somewhere along the line, we'll find out. And I was thinking to myself, that's absolutely unacceptable. That is just not right. Here you are sitting on the top of the food chain. You're a neurosurgeon, the best of the best. And you're black, and they can't even offer any reason why we are so susceptible to it. Because if we don't know why, then how on earth are we going to know what to do about it? How will we know how to prevent it? How will we know what things to avoid? How will we know when to seek help? So to me, it's just, in my opinion, unacceptable. And I feel that there should be more Black doctors like myself out in the open talking about these things. And so hopefully, maybe we'll talk about some of these reasons. I can tell you for a fact there are at least 7. That's 7 categories of reasons, not 7 individual reasons. There are 7 categories of reasons we found out why Black people have higher rates of dementia than whites, at least.
So dementia, it seems like people are getting it at an earlier age now. I actually used to work in a nursing facility, nursing care, assisted living, and there was one particular woman that I know. She got it in her 40s. Can you say what would cause? Because I mean, it used to be like the old people's disease. Because my great grandmother had it. She was like 89. My grandmother had it. She was in her 90s. So can you say why the uptick on the younger ones?
Yes. I mean, we don't have all the answers, but it certainly has a lot to do with the environment and the lifestyles and what our bodies are exposed to. Remember, we are living in a more toxic world than we've ever been in the past. So anything from the toxins, the fake foods, the things that we put in our bodies, the things we put on top of our bodies, on our skins, the things we put on our hair. Also the cell phones, also just the kind of lifestyle like we've said. And don't forget, I talk about this all the time, that there are certain things that we Black people in particular are deficient in, that help to protect our brains. So if those protections are not in place, then over a period of time, we can be subject to more damage to our brains over a period of time. And one of the things I always talk about, as you know, Dr. King, is vitamin D. Vitamin D3 specifically has been proven to protect the brain from damage if it's in ample supply, if it's in good levels in the body. Also, there could be genetic factors as well. What we know is that if you get dementia after 65, it's the adults, it's called the mature or adults normal. I don't know if you can use that word normal, but normal or regular dementia. Below 65, they call it early onset dementia. And that has been more linked to genes, maybe some genetic predisposition, maybe something you inherited from your parents that make you more prone to dementia. But if the genetic link is not there, then it's most likely a lifestyle factor.
Yeah. So Tony says, can you get early signs?
Is she asking for what are the
You
early
want to
signs?
know, yeah. Are there things that you can look for to say that might indicate that you will get it?
Yes. So let me see if I can rephrase the question. So there are certain risk factors that can make you more prone to dementia, and I talk about that in my series called Dementia's Dirty Dozen. Have we done that? Have I done that with you before? Okay, maybe. So Dementia's Dirty Dozen is like there are 12 factors that put you on the highway, the fast track towards dementia. They all start with the letter I. I can list them out if you want me to, but basically they all start with the letter I, like I said, and they range from things like illnesses to infections to toxins. I call them insults, and so on and so forth over a period of time. Now, if we're talking about the signs that maybe you're like, okay, this person looks like he might be getting closer and closer to dementia. I would say things like uncontrolled blood pressure, uncontrolled
Mhm.
diabetes. High blood sugar is a killer to the brain, especially the memory centers of the brain. Um, not sleeping well, maybe you're on the night shift a lot, or you have a lot of stress. You live in a stressful neighborhood, and you're always worried. And this is another thing that makes they say women are more prone to, because women tend to worry a lot more. They tend to be more prone to stress. They carry the weight of their families, the needs of the families on their shoulders, and they tend to worry a lot more about that. So those are issues. Now, if a person starts showing signs of dementia, they could be things like repeating a question over and over again,
Mhm.
or telling the same story over and over again, or forgetting names of people that are close to you that you shouldn't
Well,
normally
wait a
forget.
minute, let me stop you there because my dad is 87 and he
Mhm.
probably is as sharp as anyone I know, but he does repeat himself. Could that just be age? I mean, his mother and his grandmother both had dementia, but he seems to be sharp in most areas, but he will repeat the same thing.
It could be, if there's nothing else. So dementia, to be classified as dementia, it has to be like a memory. I mean, there are four main things: memory issues, mood disturbances, maybe problems with just controlling your impulse, certain impulses, and just problems just processing information, understanding what someone is saying, and responding to what the person is saying. So that's the processing, the ability to think and understand what is being said. So it's not just about memory. So if it's just that he's repeating himself a lot, I mean, that's, sorry to say, that's an old person's thing. Old people like telling the same stories over and over again, and they
But I
probably,
mean, if he forgets that he told me something yesterday or the day
it's,
before, and I'll be
yeah,
like, "Yeah, Dad, you told me that."
yeah, and I still wouldn't be as concerned unless there are other things going on. I mean, if it were my dad, I would certainly start him on a program to improve his
Right, I
his-
can't get my
yeah,
dad on no kind of program. So,
yeah. So yeah, well, he doesn't take any pills at all.
I'm like, what?
I mean, does he take any
I don't
medications?
live with him, but I don't know. I mean, he takes vitamins. I don't know. I
Okay.
don't know.
Listen, it's rare to come up with an 87-year-old who isn't taking some kind of medication. So
Oh
I
no, he's taking. He's diabetic. He's taking some, the regular,
okay,
like
okay,
regular stuff. But
okay. So I definitely would slip in if some pills that would help with his brain, help repair his brain, if it were my dad, for sure.
well, I don't live, and we don't even live in the same state.
Yeah.
And so anyway, um, okay, Jacqueline, we want to. Tony's on, Jacqueline's on, Sandrell, Angela, Sarah. Would you all please share the broadcast? Yeah. So, but there is a possibility that people just get old and they kind of forget. I mean,
Yeah.
87 is a good, nice life.
Yeah, definitely. Definitely. Like I said, dementia, people just always think, oh, it's all about memory and that's it. That's not true. There are people who have severe memory loss, worse than most dementia parents patients, or Alzheimer's dementia patients, disease patients, and they would not be classified as having dementia. It has to be in combination with one or two other things that will classify as dementia. And the key is progressive what is known as neurodegeneration. The progressive is the brain is degenerating, rusting, corroding, dying over a period of time.
Well,
And
we
some people
talk
have
we talk a lot about. In case you guys don't remember, Dr. Ajibade has been on our platform a lot. He actually used to come on, I think, weekly at one time until he got too big for us, y'all. Uh,
don't do it. Always an honor, always a pleasure. Yeah.
no, I like to mess with you, Doc. But I know you said, and we talk about this all the time. Vitamin D is so crucial in so many areas because you told me before it helps, ward off cancer and so many things. I want you to emphasize again how important it is to have vitamin D and why we lack it.
Why we lack it?
Well, I mean, when I say why we lack it is because we have the dark skin. You know what I mean?
Right, right. I just wanted to be sure I understood what you said. What you said.
Mm-hmm.
Yeah, yeah. So vitamin D. Let me just start by saying it's a big mistake that they called it a vitamin, because once you start talking vitamin, most doctors, healthcare professionals switch off, because we've been trained, unfortunately, to have a deep level of disdain for anything supplement and vitamin. Vitamin D is not a vitamin. It's like it's they call it a pro hormone. Um, a vitamin is something that your body cannot make by definition. So, vitamin D, your body has to make it in the skin when exposed to sunlight, direct rays from the sun, not heat. That's another mistake people make. People think that, well, I'm in my car, it's hot outside, it's hot inside my car as well, so I should be fine. No, your skin, there has to be nothing between your skin and the sun, because it's only when what are known as the UV ultraviolet B rays of the sun strike your skin that your body is able to make vitamin D. And unfortunately, for one, most of us, especially Black people, I'm not trying to slight us now, but we tend not to like to be out in the sun as much. I see this in the US. I see it also in Nigeria. Once you start making money, you're in your air-conditioned home, to your air-conditioned house, to your air-conditioned office. That's it. Nobody's out in the woods, and you almost never find people coming trekking long distances in the woods or so on and so forth. So we need to be exposed to the sun. But during the winter, even if you're out in the sun, you can't even get enough. You can't get vitamin D because the ultraviolet B rays are not getting from the sun through the atmosphere to the earth to your skin. There's something about the tilt of the earth that prevents you from getting the ultraviolet B rays. What does vitamin D do? Let's talk about that a little bit. We know that overall vitamin D is good for the bones. We all know that, but in addition to that, it's very important for the immune system. It helps to strengthen the immune system, which is why during COVID-19, everybody was shouting, take your vitamin D. And that's why Black people were dying so much, because we were low in vitamin D and not enough doctors were telling us to take vitamin D. And so we were just getting slaughtered. I mean, there are some places that was terrible, especially during the winter. So immune system, the bone health, it also helps with the cardiovascular system. It helps people who even have high blood pressure. It helps you regulate your blood pressure. It helps you with heart health. But coming to dementia, we are now finding out, and this is amazing, we're now finding out that throughout life, from birth to death, vitamin D is important for the protection of the nerve cells, or the brain cells are called neurons. It's also important for the synapses, the connections. When two brain cells come together, the signal transmits from one brain cell to the other. That whole marriage where the two brain cells meet is called a synapse, and the vitamin D is important for that as well. Vitamin D is also important for insulin, to help you to take up sugar, help you use glucose. So it's important for insulin resistance. It helps you less insulin resistance, help you be more sensitive to insulin. It helps with your sleep. And one of the things that we know, that people who don't sleep well are more prone to having dementia. It helps you sleep better. So there's a slew of things. It helps with your stress levels. There's a slew of things that vitamin D is important for. But again, it's in my opinion, it's most important for the protection of the brain. And over again, we know that Black people around the world, we always are the bottom of the barrel when it comes to vitamin D. We always have the lowest amounts, which again is why I don't understand, Dr. King, why aren't Black doctors coming out and talking about this, checking their patients' vitamin D levels? It should be a law that if you have a Black patient, any patient really, but a Black patient in particular, they should check their vitamin D levels, because you could be saving that person's life in so many different ways if you ensure that they have good vitamin D levels.
Thank you, Angela. Angela said she shared the broadcast. And Edith, let me put it on here. And what's the difference between regular vitamin D and D3?
Uh, D3 is the regular vitamin D. There's D1 and D2. D2 is found in plants. It's not as effective. It's not as bioavailable. It's not as easily absorbed as D3 is. D3 is a lot safer. You can get toxic levels of D2. It's a little harder to get toxic levels of D3. And guess what? D2 is when a doctor prescribes vitamin D for you, it's most likely going to be D2, which as I just said, is the less effective one and less bioavailable one. They don't know this, but that's just a claim fact. You would be much better off just going to an Amazon or Sam's Club, and you could get a bottle for less than $10 that would last you 6 months. If you go to the doctor, you would have to pay like $50 plus to get maybe a month's supply.
You also can get it on Amazon, because I do. Edith says, can you get too much vitamin D? That's one question. And then Raquel has one too. But can you get too much vitamin D?
Yes, you can, but it's a lot more than what they tend to give you. They tend to prescribe. Now, the standard dose. Let me start with the standard dose is about 600 to 800 international units. That is what is the RDA, required dietary assistant allowance. In my opinion, that is painfully low. Clearly, those people were not thinking about Black people when they did that test. Now, the Institute of Medicine has gone up to about 2,000 with an upper limit of 4,000. So the Institute of Medicine says about 4,000. There are now people who are in the know who say you can take some people recommend 10,000. But again, these are all people who are thinking more of white patients. From what we've seen, and I can only talk about my patients whom I'm authorized to treat in Nigeria, I don't accept anything less than 10,000 during the winter or when the sun is not out. Then 5,000 during the summer, 5,000 international units. And I say this because those are the levels needed to get your blood levels above 40 or 60. I've got to mention this, but the range, the blood levels of vitamin D is measured in what is known as nanograms per milliliter, Ng/ml, and the range is from 30 to 100. So it's a really wide range. Anything less than 30 is insufficient. Anything less than 20 is deficient. When we start testing, and I've spoken to many of my doctor friends, most Black people are less than 20. Most, especially if you're over 40, you're overweight, and you're dark skinned, you're most likely, and this being winter, you're most likely going to be deficient if you have not been actively supplementing. So I don't like taking chances. So I recommend 10,000 for the winter periods, 5,000 for the summer periods. And if you're not going out getting on in the sun, then you need to take 10,000 as well. Again, you need to check with your doctor. I'm just telling you what I do for my patients and for myself. But 800 international units, in my opinion, is not going to cut it for a Black person. Certainly a Black person who is over 40 years of age, because the older you get, the less you're able to make vitamin D. The older you get, the more challenges you have. And vitamin D, like we just mentioned, is important for helping the cardiovascular system, helping the immune system, helping the brain, helping the skeletal system. So you need as much as you can. I tested my blood levels last; it was 83. So I'm okay. I still would be more comfortable if it was closer to 100, because that is what the doctors are saying. Is the doctors who treat dementia, they're saying that you should be closer to 100. Those who are really getting results.
Nicole says, what if the vitamin D level is high?
I don't understand what that means.
Well, I can't tell you what it means. I'm just reading the question.
Yeah, maybe Nicole, maybe you should expatiate, maybe explain more so I can answer your question properly.
Sarah Netler says her doctor prescribed 50,000 IU for her and her husband once a week. Is that realistic?
Yeah, I mean, so that's like what would that be now? That's like 7,000 international units a day. That's fine too. That's fine. What they found out is that the daily dose is probably better than the weekly dose. That when they've done the split testing and seen which is effective. So I prefer to just recommend the daily doses. But for weekly doses, it's more convenient, I guess. Once a week is more convenient. Whatever, you just need to be ensuring you get your vitamin D on a regular basis.
So we've actually shifted to vitamin D, and it's really important because you and I have talked many times, and I don't ever recall us discussing that vitamin D had a direct impact on dementia. I don't remember that.
I you know I knew it had an effect on the brain, but it's only until recently that I started reading the studies they've done with regards to dementia specifically. And I got to tell you, when I started seeing this, I was shocked. I mean, even for someone who has been singing the praises of vitamin D all this time, I was shocked that it was that of the role it played. So yeah, this is just it's a more recent thing that's come to my radar.
Um, so is it okay? I mean, because we're not, I'm going to tell you right now, we're not telling you to go out and buy all this stuff. He's telling you what the studies that he has found and what he has found. So don't go back and say BWE told you to go out and get 50 things of that vitamin D. That is not correct. We're only telling you what Dr. Ajibade has found in his study. If you're going to a medical doctor, should they ask to be tested? They can ask to be tested, right?
Yes, I would recommend that they go ahead and test, but you can go to a lab and test yourself. But obviously, you would need to get it to get it paid for by insurance. You probably need a doctor's prescription. Some doctors wouldn't even do it, but
Well, if you ask them, they should, right?
some of them still wouldn't
Why not?
because they will say, "What is the indication? You're not sick. Your bones are okay as far as they're concerned." I
How
mean,
can they tell if your bones are okay?
I'm just coming up with excuses they
Oh,
might come up with.
okay. And you're welcome, Miss Davis, Gina Davis. She said, thank you for the information. So, you want to tell them how they can follow you? And Dr. Ajibade does some great podcasts and really great information on a lot of things. So go ahead and give them your information, Doc.
All right, thank you. Well, we are starting a channel, a YouTube channel specifically devoted to dementia and blacks. So I would say, why don't you send us an email and we'll get you on that list. Info at brainandbodyfoundation.org. That's info
Type it in.
brainandbodyfoundation.org. Oh, you want me to type it in? Okay.
I'm typing it in.
Okay, got it. Got it. Good. Thank you.
Info at what?
Brain and Body Foundation.
Is it and the and sign or A and D?
AND.
Keep talking.
Info at brainandbodyfoundation.org.
I'm not talking about that. I'm talking about just keep talking.
Okay. Yeah,
Period.
cool. Yeah. So in this we're going to point out the real risk, the risk that we have, these high levels of risk for dementia. And we'll be going through what the Dementia's Dirty Dozen, but we also go through the 7 reasons why blacks have such higher rates. And let me start. I use the acronym GILEAD, as in Balm of Gilead. So G stands for genetics, your genes, our genes. I stands for specific illnesses like hypertension and diabetes. We have higher rates of that. Um, L stands for lifestyle factors. E stands for environments, and or slash education. A big problem, especially with our younger folks, that they're not getting educated like they should. Baltimore is a typical example. A stands for um, access, so access to good healthcare, access to good healthcare, or availability of good healthcare. And then D stands for diet, which of course includes we're talking about things, supplementation, things that I'm missing from my diets. And part of it too, just to say a few things about this, what we're now beginning to find out is that um, about 10 to 15 years before someone eventually comes down with dementia, their rate of usage of glucose, which is the brain's number one fuel, it reduces by about 50%. For some reason, the brain is not able to efficiently use glucose like it was using like it does in the normal human being. And they are pointing to the fact that there's what is known as insulin resistance. The brain is not responding enough to insulin, and therefore not taking in glucose and not using glucose like it should. And one of the causes for that, one of the main causes for that is the high sugar intake that many of us, especially Black people, I know this should not be a news to anybody, but we tend to like sweet stuff. We tend to of all the demographics, we tend to take the highest levels of sweet beverages, Coke, Fanta, and so on, Mountain Dew, and so on. We take a lot of that stuff. We also tend to eat a lot of junk food and fried foods more than the average population. These high levels of sugary stuff is placing a huge burden on our bodies and making us, especially on our brains, and making us less responsive. It gives us less ability to use glucose. I'm just using this as an example. We can go into we are going to go into this in greater detail on our YouTube channel and explain some of these things. But one of the things that most dietitians and nutritionists and doctors are saying is that if we can get African Americans to reduce their soda intake, we can go a long way towards improving their long-term brain health.
Yeah. So Thanksgiving is Thursday, and I will be making sweet potato pies. I'm just letting you know up front. I'll just take some extra vitamin D because
Yes.
there's a lot of sugar in my sweet potato pies.
Yeah.
But this is
Yeah, you can start any resolutions. You can start after Thanksgiving. You wait until you're done. Enjoy your Thanksgiving.
Well, then we're going into Christmas. So
then we're going into Christmas. Oh my goodness! So we're just going to have to wait until the New Year and have a New Year's resolution. How about that?
Let's see what Julian. Sarah said, "Thank you for the information." Julian says, "This is excellent. I'm a nurse in Toronto and a person-centered care, and I am especially interested in observing the treatment of our people in the long-term care center setting." Excellent discussion. Thank you so much, Julian, I think it is Latham. Thank you for that. I love it when you all are interactive. That first of all, lets us know that you're listening. And I'm asking you again to please share the broadcast. You help us reach other people. And we actually are live on 5 Facebook pages. We're on YouTube and we're on LinkedIn simultaneously. So you can get us you see the email scrolling across the bottom, you know that we have our new Christian Women Level Up. That's what we're bringing you, all types of people to help you level up with your personal life, your professional life, spiritually, in every area. And that's why Dr. Ajibade is going to have to be coming back more often, because he doesn't really want to spend that much time with me anymore. I'm kidding. I have to do it, Doc. I got to do it. But But Dr. Mercy comes on Fridays, every Friday, and Dr. Hammond comes on and does mental health moment. We really do give you some great people that share some great information, but you need to share it and adhere to it. So anyway, Doc, any closing remarks?
Yeah, thank you for having me again. I just want to point out that it's not just vitamin D that we found out that people are missing in. The other Black people in particular. There are other things like potassium, magnesium, vitamin B1, vitamin B12. Again, we'll
Mhm.
talk about all of these things. As a matter of fact, I'm putting together a formulation that's specifically with the adult Black person's brain in mind, so we can just in one fell swoop, rather than taking like 10 or 15 bottles, which I have like on my desk next to me. I want to put everything together in one formulation, one supplement, so that it makes it for convenience sake, so people can just have what their brains need at every point in time. So, for those of you who are interested, again, you have the email address, and you can follow us on our YouTube channel and us
Okay,
and
it's
let.
on the screen now. I just put it up on the screen. I had already posted it. Please write it down. Do you see it, Doc?
Yeah, I can. That's great.
So
Thank you.
write the email down. It is on the screen. I did type it in, but the people were talking, so you didn't get a chance to see it. But it's on the screen. There's no reason why you can't email them. There it is. There. Um, Doc, so
Great.
we got to do a better job of coming back. We're supposed to do something on prostate um, cancer, and I wanted to tell you too that my dad um, actually recently had his prostate exam because he had a high. Is it a high pH?
PSA.
Okay. And they wanted to check him, and he came back completely normal. The doctor
Oh,
said he had
fantastic.
never seen anyone with that high of a PSA that was completely normal. So I was pretty excited. He was pretty excited about that too.
Fantastic.
So
Fantastic.
we're gonna do something for the men, um, and then we'll be back talking about various things. Doc always has something that he can discuss, and so we'll be back. Doc, thank you so much for this time, um, and we'll do it again.
All righty. Thank you so much, Dr. King. You take care.
All right,
Bye,
thank you,
everyone.
everybody. Have a happy Thanksgiving.
Happy Thanksgiving.